Homelessness in London is on the increase. Over the last 5 years, it's doubled. Having no stability in your life. Mental health is definitely a factor. Tuberculosis, substance misuse while on the streets.
I think there's a bit of a misconception about homelessness, that it's all about inner London and it's only about rough sleepers. But actually one of the big parts of our programme is trying to point out that it's a city-wide issue.
There's a massive hidden homelessness, sofa surfers, people who are inadequately housed.
Homeless people have complex needs. The effect of this means that normal systems that the everyday population use are much harder to navigate for homeless people.
If you don't have an address, so if you're no fixed abode or you don't have ID, that you can't register with a GP, which isn't actually true, but so a lot of people experience problems with access.
Just navigating the health system, it's a strange place to be in. For me personally, the complicated language that doctors and nurses use can be overwhelming.
It makes it more important, therefore, that we are seen as welcoming, we are seen as open to whatever someone wishes to tell us.
The London Homeless Health Programme exists primarily to try to drive a pan-London response. Our main action at the moment is to have a consistent offering to the homeless across the whole city to make sure that people's needs are represented no matter where they turn up.
Everything we do really comes down to partnership working. The voluntary sector is a hugely important partnership. It brings expertise, it brings passion.
The programme's going to help by informing commissioners how to structure services so the NHS and the voluntary sector and the client themselves, it works for everybody.
Our aim across everything that we're doing in health is to prevent problems, to detect problems earlier and to intervene earlier. And therefore much of that will be about general practice. It'll be trying to pick up problems that someone may have, deal with it where appropriate in general practice so that emergency treatment, A&E departments are used where they're needed for accidents or for emergencies. Someone who is homeless has absolute right to register with the general practice. You do not need to have a permanent address nor proof of address to be eligible to register with the practice. The first point of contact for anyone with general practice and for homeless people will be reception, will be the front desk. So we need to get it right at that first point of contact.
I think the answer is quite simple. It's about involving homeless people in the solution. I think it's the best way forward. We know what it is that we need. Rather than top down, it's bottom up.
We know that many of the answers come from people who are either going to use services or are using services, and it's important therefore that we tap into that and make use of it.
We think this programme is the beginning of a very positive dialogue in London to make sure that people are supported no matter where they are, no matter what their needs.
For people who are homeless, there absolutely is a way back, there is a route out, and good healthcare is an important part of that.